The healthcare dynamic is rapidly changing. Understanding the basic fundamentals related to the business of medicine empowers practitioners to advance their skills in and knowledge of the business aspects of medicine. SMA's Business of Medicine Simplified program explores the essentials of everything from reimbursement and compensation models, insurance and risk management, to practice employment and business finance. Today we are discussing career development for physicians and are delighted to have Dr. Nneka Unachukwu, Dr. Una as she is commonly known, joining us. Dr. Una is a board-certified physician and fellow of the American Academy of Pediatrics. At the end of her residency, she relocated from New Jersey to Georgia and initially worked in private practice and then went on to become the CEO and lead pediatrician at Ivy League Pediatrics. Thank you for joining us today, Dr. Una.
Thank you. I'm so excited to be on here today.
We are really looking forward to discussing career development for physicians today. And let's begin with, how do you find the time to do anything other than your 9-to-5 job?
Well, that's a great question, because it's a question I get all the time, seeing how busy physicians typically are. But the truth of the matter is that it starts with a mindset. It starts with the mindset shift of, I want to make the investment to do something else now so I can set myself to have so much more time later on. The same thing we did when we were in medical school or when we were in residency. We had really long hours. We had to do more than most people had to do. Well, we had the mindset that if I do this, it may suck for a few years, but after that, I get to be a physician. After that, maybe I get to help a lot of people. I get to earn more, So it starts from there. The first thing is the mindset. And then the other thing is to look for all those sneaky things that we actually spend a lot of time doing. So for instance, social media will be one of them, because most busy doctors have at least 2 hours to spend on social media every day, which could be 2 hours towards working on a business, working on phase 2 of our careers. And it could also be things that maybe we just need to delegate, like laundry, mowing the lawn, stuff like that. Those are things that we can delegate and add that time to working on building a business. So we have the time to do that. We need to make the shift and then, reclaim our time.
Those are things that you don't necessarily think about, but that definitely do play into your daily activities. Correct?
Right. Every day.
For someone who is wanting to start a practice, where would one begin?
So I find that based on our training, we're really great clinicians, and we typically know nothing about business, except we were brought up in families where there were entrepreneurs. But based on our training, we don't really get much on that. So I see wanting to start a practice like trying to learn a whole new language. And the best way to learn a new language is through immersion. So if I wanted to learn Spanish, for instance, you can throw me in a Spanish-speaking country for a year or two, and chances are I'll pick it up. You know what I mean? As opposed to taking a ton of Spanish classes living in the US. So
sort of like a trial by fire, if you would.
Yes, yeah. But it changes. You end up learning a lot of things by default, kind of, if you are in immersion. So when it comes to business, the immersion comes, you have to be in that environment. You have to be hearing the right things. You have to be in the right place. So for instance, when we're coming up as physicians, we're not listening to business podcasts. But if you're going to start a practice, that needs to be something that maybe you throw into your daily habit. Like every day I listen to one business podcast. Over time, it rewires and changes the way you think so you can get set up. Reading business books. We've read a lot of clinical books, medical books, but is that time to say, maybe I'm going to read 2 books a month on business and stuff like that. When I started my practice, I think I probably looked over at least 150 websites of pediatric practices, looking at how many pediatricians do they have? What kind of services do they offer? What kind of support staff do they have? I looked at their reviews. What are the patients complaining about, right? So those are things I know, okay, when I build my practice, then I need to make sure I'm doing this the right way. And then the most important thing is working on the relationships that you have. So if you're going to start a practice now, you want to get people who are practice owners and insert yourself into their world, because you're going to need to ask questions. You're going to need to see them in action. You're going to find out what they're reading, what they're doing, how did they start. So you have to change your circle, and it's not going to happen by accident. You're actually going to say, you know, that person owns a practice. It's not too big. It's two physicians. That's one physician. They've been there for 5 years. They're thriving. And you're going to reach out. You're going to say, hey, can I do lunch? Hey, can I pick your brain? Hey, can I do this? You have to immerse yourself with all things business if you're going to start.
It sounds like almost you need to find yourself a mentor.
Absolutely.
Guide you through the beginning process of this, and to not go it alone, that to turn to your colleagues or someone who can help guide you through this. Why should I care about the business of medicine? Why, as physicians look to do this, it is obviously important, but to someone just starting out, what would you say to them, and how would you stress the importance?
Well, so the healthcare industry really has changed so much. I finished residency 11 years ago, and the landscape was very different. Telemedicine wasn't a big thing, for instance, and I never thought my competition would be CVS. Right? There are no minute clinics, there are no retail clinics, there were barely any urgent cares. So it used to be people either went to the hospital, they went to the primary care provider. So maybe you own a practice, you don't even have to market, right? You don't have to compete, because it's literally, you know, hang your shingle and they will come. The healthcare industry is so different now that the hang your shingle and they will come philosophy doesn't work anymore. You're going to have to learn to compete. You're going to have to learn to employ the same business principles that other businesses are employing if you're going to thrive as a physician. So if you're going to be, especially if you're going to be in the I own my practice space, you're going to have to embrace entrepreneurship on a whole new level, very different from just being a clinician. And the other thing is, I don't believe that you'll be able to do all the things you want to do without being an entrepreneur, right? So let me say you're a physician and your passion is really, you know, I want to take care of people who are obese. I want to end the problem of obesity. It's a multi-billion-dollar problem that the country has. You may want to do that. You may be skilled to do that. But if you're actually going to do that, you're going to have to learn how to build businesses, because that's the vehicle that you're going to use to get what you want done. So there are many physicians who have so much more they want to do than what they're doing now, but the vehicle for them to be able to do that is business. So we do have to embrace entrepreneurship.
What would you say are the top 3 mistakes that practice owners make today?
Well, number one is not realizing that medicine is a business. Some people do get offended when you say the business of medicine. They're like, it's not a business. It's about taking care of patients. And I'm like, yes, but you know, if you still have to do payroll and you still have to pay for the utilities and you still have to get supplies, then you're going to have to use business principles. So I think that's the first mistake, is not realizing that it's a business. The second is pretty close to it, and that is not learning the business principles, thinking if I'm a good clinician, then I'm going to have a great practice. And really, if you're going to have a great practice, you need to have 2 skill sets that you're really good at. And one will be your clinical skills, and the second will be your business skills. Clinical skills, it takes about a decade to go through the whole process. And so when it comes to business skills, we're going to have to pay the price. It's not going to take a decade, but we're going to have to apply ourselves to learn those new skills. They're not going to happen to us by default at all. So that's the second mistake that I see a lot of people making. And then third is trying to do everything, try to do everything by themselves. Like if it's going to be done right, is because I did it. So their practices I've seen, the doctor answers the phone, the doctor gives all the vaccines, the doctor does all of that. But really, it's a disservice to your patients, because at least it can be a disservice to your patients, especially if you're turning people away because there's only so much you could do. You could leverage a team to get so much more done, be able to help so many more people, and then, have a profitable business as well. So those are the top 3 mistakes that I've noticed.
And it's realizing you have resources, and don't be afraid to draw upon those. There are people who can help you, who want to help you succeed. And it's always a good thing to look to those individuals and draw on their strengths as well as you build your practice.
Correct. And the truth of the matter is, a lot of people do want the help, but the hard part is you have to train the people, right? You have to put up with some stuff. I always say that people will be they'll give you your greatest blessings, but they'll also cause you your worst pain, So in training and hiring and dehiring sometimes and all, it's hard. But the return on investment in that is on that is worth going through it. So embrace the pain is the only way to go up, really.
That sounds like great advice. And speaking of advice, what advice would you give your younger self on the day you completed your residency?
Oh boy. Okay. All right. So I'll give you the whole spill on that. So the first thing I would tell myself is, this is not the end. This is a beginning. Because what happens is, you work so hard in high school to make sure you get into a good pre-med program. And then in pre-med, you work so hard to get into med school. And in med school, you work so hard so you can get into a great residency. And if you did fellowship, you work so hard to get into fellowship. And it's kind of like when you get to the end of the line, you're like, I'm done. Like, don't talk to me. Don't tell me to read it. Just leave me alone. I'm done. And the truth of the matter is, it's the close of one chapter, but really it's the beginning of a whole new thing. I would tell myself, don't stop, don't settle. You haven't arrived, you're not there yet. This is great, but there's so much more. And I would force myself to look at an overview of what a really good physician career would look like. So what that would look like is, in phase 1, is my active phase. So I'm working, I'm seeing patients, I'm doing the 9 to 5, in primary care, maybe doing 25 patients a day and all that stuff. Same way a basketball player comes into the NBA and they're just playing. That's what they do. But as time goes on, I should be able to switch to my leveraged career, where if it's a basketball player, like a LeBron, they've built their expertise, they've built their name, they've built their brand. So now maybe I can do some endorsements, or I can be in some movies, or I can be in some music videos, or I can be a brand ambassador because of how good I was as a player. We can do that as physicians as well. We could build practices, we could speak, we could be brand ambassadors, we could be consultants. There's so many things we can do where you can earn as much doing that as you did seeing patients and doing the day-to-day. And then after the leverage career, there's the passive career, where I've been investing out of my active and leverage career. So I'm at this point where I work because I want to, because I have stuff in real estate and all this stuff that's taking care of what I need, whatever I need to do financially. And I can do what I want to do, whether that's seeing patients 5 days a week, or staying home with the kids, or going to practice in Haiti for 2 years doing free surgeries. So I would tell myself, don't stop. There's still so much. What you have is just the raw material for what comes next.
Learning really is a lifelong process, isn't it?
It is. It absolutely is.
Dr. Una, this has been a most informative conversation, and we are delighted that you were able to join us today. Thank you for spending some time with us.
Well, thank you. Thank you so much for having me.
Would you like to learn more about this topic? Make plans to attend SMA's Southern Regional Assembly October 31st through November 2nd in Birmingham, Alabama. Visit sma.org/assembly for more information and to register.